Well, it's been from one health talk to another. Okay, and so this time around, I've got Dr. Charles Adeogun in the studio this afternoon. All right, good to have you, Doctor.
Good afternoon. Thank you.
Good afternoon. The last time you came here was how many months ago?
I think it was in January.
January? Are you sure?
Yeah.
Whoa. Okay. Okay, that's good. But good to have you join us actually. So everyone was streaming live, okay? Was streaming. Just go there, join us, all right, in this conversation. You need to hear this one. No, you need to hear this one. It's very, very, very important. Okay. My name is Judah. Anyway, in case you're just tuning in, and it matters. Health matters. That's what we want to discuss today. It's Friday. Like I said, thank God it's Friday. And of course, in case you don't know, I'll be celebrating my birthday tomorrow. But then I want you to be well. Yes, that's the first thing for me. And doctor is going to help us outline or understand some of these illnesses that we should watch out for. All right, these common illnesses here and there flying around, because hey, Lagos, this is not the best time to fall. If you sick, you are in trouble. So please talk to us. There are some of these little things that people just play with here and there. You know, that's one of the things I want you to talk to us about today on the show. Please do talk to us.
All right, thank you. Thanks for having me again, and happy birthday in advance.
Thank you.
Yeah. So talking about health, we have a lot of people who have some illnesses that they are unaware of, and basically some of these illnesses do not have symptoms like the high blood pressure. I always emphasize on high blood pressure all the time, because now as much as 1 in 3 adults is hypertensive. So a number of people have high blood pressure, and because it doesn't have any symptoms, they seem to move about, doing their normal daily activities, feeling they are well. And if peradventure they get to check their blood pressure by going to the clinic, or maybe there's an outreach, or somebody somewhere just says, why not check your blood pressure? And you would see alarming blood pressure readings. And you'll be wondering, how would somebody have this kind of reading and has never known about it? And the risk factors associated with high blood pressure, especially when it is uncontrolled and it stays for so long, includes coming down with a stroke suddenly, coming down with kidney failure, heart attacks, sudden deaths, and all that. That's why we hear people say, oh, they saw this person the day before, he was hale and hearty, he looked strong, he looked well, or they saw him that same morning, he got to work, and all of a sudden something happens and, the person is gone. So most times there are underlying factors that are responsible for this kind of deaths or complications that were missed from the beginning. So this is an avenue for people to realize that if you're an adult, please, regardless of your age, because it's no longer an age thing now, everybody must take responsibility for their health. Always have your blood pressure checked. Do not assume.
First thing.
Yes, especially when you have a positive family history. Either parents having blood pressure, or you have siblings, close relations, having high blood pressure. There's a high risk of you having the same. If you know you are overweight, your risk of having blood pressure is very, very high. You're probably going to be hypertensive without knowing. And if you know you have been having sleep issues, you drink a lot of alcohol, you smoke a lot, all those factors, they've been found to be very, very relevant risk factors associated with high blood pressure. Then people that consume a lot of salt, people that take a lot of processed foods, people that, are constantly stressed out. The stress management is zero for them. They're always doing 1,001 things at the same time. Their stress hormones are high. Those are people who are at an increased risk of developing high blood
I wanted
pressure.
to break it down, because a couple of persons are listening. When you say processed food,
processed foods are not natural foods. They're foods that have gone through all sorts of preservation, all sorts of additives are there, they've gone through all sorts of processing in the manufacturing or production of such foods. And such foods, first and foremost, they are appealing to you. So what you will find out is the taste, the aroma, the additives there are just to attract you and to allure you to the food. But in terms of nutritional value, they're not really doing much for you.
for example, please.
It's not right for us to mention names here, but we'll be mentioning a lot of brands that people know about.
Okay.
But basically, there are a lot of foods that, are not natural, and it is best for you to go natural with your food. Eat a lot of fruits and vegetables, eat a lot of homemade food. if we put it that way, if you cook the food you eat, you're most likely going to eat healthy, because most of the processed foods and the junks and all that, things that you buy outside, the foods that you get on the move, because you don't have time, you're always in a hurry to move on, so anything you can grab here and there, you just snack on those things, and those things are not healthy, not to talk of the sodas and then the unnatural drinks that we also take that have a lot of colorings, flavorings and all that. By the time you see not naturally occurring color in drinks, you see lemon color, you see purple color, you see blue color, and they all taste sweet, taste nice and appealing. All those things are artificial colorings, and they are not healthy. And those additives and preservatives that are there are to increase the shelf life or improve the shelf life of those products, so that when you get them, they still taste nice and fresh and all that. But those preservatives are chemicals that are not good for your body. They are not good for your system. And some of them have been found to even be carcinogenic, meaning that they can be cancer causing. So it's very important for people to always check their blood pressure, know your sugar readings, especially if you have a history of high sugar, or you have a positive family history of diabetes as well. If you are overweight, even people that are not overweight, you should know their cholesterol levels. There are some important parameters that you should know. Some important indices: your blood pressure, your body mass index, your blood sugar, your lipid profile. Very, very essential. Then for people who drink a lot of alcohol, please, there's nothing like I've been drinking alcohol for 30 years.
I want to see that, really. I've been okay. I'm okay, and I'll always be okay.
I have never had any issue. I've been drinking all sorts. Please go for a liver function test. You never know. You never know how far you've gone, because sometimes some of these things just happen, and everything just starts falling like a pack of cards, just like that. And you'll be wondering, this was a very, very healthy person. Why are things just nosediving all of a sudden? It happens. And you just see the person nosediving very fast. And everybody can't put a finger to why that is happening. But most times, if you take a good look and you scrutinize well, there's been something underlying that has been missed. And this happens all the time. Women are a bit better than men in taking care of their health, because for some reason, they go to the hospital more frequently than men do. Because when a woman is pregnant, she goes for antenatal. During delivery, she goes for, to the hospital to deliver. And for most of them, they take the child for immunization and all that. So they have more frequent visits, and they're likely going to check one of these things. Or somebody will have to tell them, oh, we're checking your child, but let us check you too. So you're likely going to pick something faster in a woman than in a man. A man is engrossed in all the activities of life and trying to make money and trying to make ends meet and all that, without taking into consideration that their own life too is important. As the breadwinner, you also want to take care of yourself, because if you do not, if something happens to the breadwinner, then the whole motive or objective of running up and down
no
is
bread
defeated.
again.
Yeah, no bread again. The bread is gone, and the giver of the bread is gone as well. So it's important that everybody starts taking right steps in making sure that they are healthy. And for the men, prostate problems are on the rise. If you are a man above 40, please make sure you know more about your prostate health. Do not assume your frequent urination is just because you drank too much water or you took too much alcohol.
Again, before you go there, I want you to break it down, because some persons really don't understand. When you say prostrate, they feel like, what is prostrate really? Tell us.
Okay, the prostate is a gland. Is typically a walnut-sized gland, that is under the bladder, towards the neck of the bladder. And whenever it enlarges, it causes some kind of obstructive symptoms to the flow of urine. So typically, as a man grows older, as he advances in age, there is enlargement of that prostate gland. And when that gland, enlarges, as we said, it gives you obstructive symptoms like you feel that you are not emptying your bladder completely. You wake up frequently at night to urinate plenty times, and you notice a reduction in the flow, in the stream of the urine. So the urine is not flowing with the pressure at the rate it's used to before. And then you notice that you have to go over and over again, and sometimes you may even have urgency such that if you feel the need to urinate, if you don't leave immediately, you may even pee on yourself before you get to the bathroom. And then for some men, they also notice that it takes a while for them to start passing urine. They stay in front of the toilet bowl, for a while before it starts coming out, and it comes out in trickles, over and over again. Those are signs not to ignore. If you're a man above 40, you're having any of these urinary symptoms, you need to go see your doctor, run some important tests. The prostate-specific antigen is a blood test. It gives you an idea of how your prostate is doing. They send you for an ultrasound scan. They see the size of your prostate, if it's actually enlarged. And if need be, they send you to the specialist, who is the urologist that takes care of such issues. They will know if it is right for you to be on some medications to improve your urine flow, or if you may need a surgery in some cases. And for some other people, unfortunately, it may be cancerous, because it's not only about the benign enlargement. There can also be prostate cancer, whereby you would now need more detailed treatment in terms of medications, radiotherapy, and all that. So unfortunately, a lot of people, they're already in the advanced stages before they present at the hospital. So if you find blood in your urine, it is abnormal. If you're not passing urine the way you used to pass before, or you're passing urine frequently more than before, it is also a sign. And if you have a family history, it is also a sign. So you need to make sure that you do not just sweep all those things under the carpet. Investigate properly, get the proper diagnosis, and let the proper line of management be instituted for you. So it's very necessary that men in particular know this, and they should cut down on alcohol, intake and smoking. Very, very essential, because most of the illnesses that men go through, these two factors are part of the main contributory risk factors. So it's important that men know this. And for the women, we cannot overemphasize your birth control. You don't need to have too many children. Have the number of children you can cater for, because every pregnancy comes with some kind of risk. So if you have about 3 children God has blessed you with, be happy with them, take care of them, and let that be it, because you don't want complications to set in. And aside that, they must always do their self-breast examination too, having an increase in breast cancer incidence also. People having lumps in their breasts, people not knowing what to look out for. It is essential that you know how to do a self-breast examination. It's very simple. It's something you can do at home. Stand in front of a mirror, use the flat of your palm to massage or palpate the 4 quadrants of the breast and feel for any lumps. And if you notice anything, please go to the hospital. That is not the time for you to want to rub something by yourself or get an ointment and think it will melt away. Please always go to investigate. And if necessary, if your doctor says you need to excise it and send a sample for histology, please do that, because that's the only way we can actually know whether it's a benign lump or a malignant lump. And if it is malignant, it is best for them to do the needful. If they need to do a mastectomy to remove the breast, so be it. It's better for you to lose a breast and be alive than for you to say you are applying all the things people apply, and at the end of the day, a problem sets in from there. So a lot of people can save their lives from timely intervention, and timely intervention can only happen when you detect early. And how do you detect early? By being observant, by checking yourself. And if you need to do a thorough examination, please go to the hospital. That's why the hospitals are there. And I advise people, please budget for your health like you budget for your rent, for your school fees, for your feeding, for your transport.
But Nigerians hardly do that.
They should
budget for health.
Yes, you should, because everybody feels I'm a strong person. I don't fall ill. I've always been a healthy person. That's what they keep telling you. But this thing is no respecter of persons, because if it comes, it comes. And the people that unfortunately these things have happened to, they never thought it was going to happen to them. Most times, it's been unbelievable. People that have been seemingly healthy, never had any significant medical problem, but things happen. So when you budget for your health, you can go for comprehensive health checks, and these things will check all the relevant tests that you need to know that is appropriate for your age, and your doctor will be able to pick up where the issues are and advise you accordingly.
Okay. Now there is something I want to ask you, but then let's see. This person has been calling. Let me hear what you have to say. Hello, good afternoon to you.
Afternoon to you. Are you online?
Yes, I am.
Are you on air?
Yeah. Good afternoon to you.
Afternoon to you. No, I thought I was listening to Asụsụ Igbo. Okay, ndị Igbo guitar. So that's what I'm going.
No. That was in the morning now. Okay, maybe your time, right? I see you're calling from outside Nigeria. It's okay. I understand. But thank you so very much for calling. Now, there's something I wanted to quickly point out. I see cases of diabetes almost everywhere. Even little children being diabetic. And I ask, why? What's going on? You ask this one, they say, no, I'm watching my sugar. Why? Diabetes. My family. I don't understand. What's really going on? Is there something we need to know?
Yes, because for children, I'm happy you raised that question. For children, there's a juvenile obesity pandemic, so to say. A lot of kids are overweight now. Many of them are overweight. You know, you see a 12-year-old, you can't believe the child is 12 years old because the child is looking like a 20-year-old. And you're wondering, how do you fit in with your peers? When you are in school, you have, you know, sporting activities and all that. How do you merge in with your peers? And, you know, the parents may just think, well, this child is just on the big side. The child has always been a big baby. How can your child be weighing over 100 kg at 12? That's a lot. That's a whole lot. You know, the bigger a person is, there's something called insulin resistance. Then your body does not respond to insulin the way it's supposed to. And insulin is the hormone that controls your blood sugar. You know, it is concerned with sugar metabolism, such that when you eat carbohydrates, your body breaks down the carbohydrates to sugars, but insulin helps to drive the sugar into the cells where they are to be used, you know, rather than them being high in the blood. But unfortunately, in people that are on the big side, like we said, even for adults too, obesity is a major risk factor for diabetes. And you have 3 types of diabetes. You have type 1 diabetes, which is insulin deficiency and is of juvenile onset. You see that in younger people, whereby the pancreas is not producing insulin at all, or is producing very little amount. In type 2, you have insulin produced, but the body is not sensitive to the insulin, and you are not getting the right response to insulin, even though insulin is present. Then the third one is gestational diabetes, where a pregnant woman who was not diabetic prior to pregnancy suddenly notices a spike in her blood sugar due to the pregnancy or during the pregnancy, and that also comes with some complications. So it's very essential for people to realize that being on the big side, being overweight, is not healthy. It poses a lot of risk factors. And how do you know you're overweight? We need to talk of the body mass index. Okay. Because looking at a person on the face value, you can't tell, oh, this person is overweight, unless you know the people that you know for sure that they are so massive, you know that definitely this person is overweight. So there's a ratio of your weight to the square of your height that gives the BMI. And once you find out that your BMI is above 25, then you are definitely overweight for your height, because for your height there should be a certain weight. So if you are exceeding that weight for your height, you're already considered overweight, and your risk factors for diabetes, high blood pressure, cardiovascular conditions, and even some type of cancers increases. Yeah, so it's important that people know that for children that are overweight, it's a lot of risk. You need to see a dietitian. You need to also go for some hormonal investigation to find out if the weight gain is due to some kind of other hormonal problems. You know, other hormonal problems too can result in a child being overweight, and you can't explain why the child is overweight. But the risk factors for diabetes, cholesterol, and everything too would now follow. So it's essential that what we eat and what we let our children eat must be, you know, properly scrutinized. We must be intentional about our diets. What you eat determines your health significantly. You can't just indulge your children to eat everything they request for or everything that appeals to them. You need to make sure that it is healthy, nourishing food that they eat at all times, because most of the junks out there, you know, will just make you keep adding weight, and all these complications of obesity would set in. And for the adults, alcohol. When you drink a lot of alcohol, you have truncal obesity, you have visceral fat, you have fatty liver, and aside that, you also can damage your pancreas, because the pancreas that produces the insulin that controls sugar can be inflamed. Acute pancreatitis occurs from alcoholism. A lot of people that drink alcohol may have pancreatitis, and if you have pancreatitis, very soon you develop diabetes. In no time, you find out that your sugar is not controlled. And diabetes is so horrible because the complications of uncontrolled diabetes affects virtually every part of your body, from causing blindness to strokes to cardiovascular problems to nerve damage to erectile dysfunction in men, to you having wounds that will not heal and having limbs amputated. You know, all those are potential, you know, these are heavy complications that nobody wants to toy with. Nobody wants to be blind. Nobody wants to lose their limbs. Nobody wants to have erectile dysfunction. Nobody wants to have an injury and not knowing they have an injury because they can't feel. because the nerves are damaged, or they're having tingling, funny numbness and sensations, they can't explain all over their bodies. So these are the consequences of uncontrolled diabetes. So diabetes is something that people can live with it, but you can reduce your chances of having it. The fact that something is in your family line doesn't necessarily mean you must have it. It just means that you belonging to that family, you've already ticked off one of the risk factors. So that means you are at risk. So you have to reduce all the other risk factors. So how do you do that? Making sure you exercise, making sure that you maintain a healthy weight, you cut off alcohol, you eat healthy, and you make sure that everything that puts you in the way of diabetes is taken away. A lot of people are sedentary. They sit down for hours, not moving around. Those are risk factors also. You say, oh
really?
Yeah, of course. You resume at 7, you're seated, and you get up at 4 p.m. You've been sitting for 9 hours. That's so unhealthy. In fact, sitting carries risk factors as heavy as smoking. It's almost like on the same rating. Yeah, because sedentary lifestyle is not good for you. It's not good for your heart. It's not good for your circulation. It's not good for your blood vessels. You can form blood clots, especially if you're obese. So everybody should get moving. So for every 2 hours of sitting down, make sure you change your position. You move, you walk around, you let your blood circulate, you let your blood flow. And if you are on drugs for any of these conditions, either hypertension or diabetes, please know it is a lifelong treatment. And please be compliant with your drug as much as possible. Do not stop a medication by yourself that a doctor has placed you on, because we find out happening very frequently in our environments. People get tired of these medications and they wean themselves off the drugs. And when they have problems with stroke suddenly, or a kidney problem, they wonder where it's from. So most of the kidney problems we hear is from uncontrolled hypertension and uncontrolled diabetes. Those are the major culprits for renal failure in our environment. So it's essential that people take this thing seriously. So this is not the time to reject it. This is not the time for you to say you have chosen to go natural, or you have chosen to go spiritual on your health. Yes, God helps us, but you have a role to play. You have your part to play. So you should be found doing your own part, and then God will bless your efforts, rather than you just assuming that everything will fall, on your laps like that. Good health doesn't just happen. It's intentional. It's a choice. It's a decision.
So how often do we go for checkup? For all of this you just mentioned.
Very frequently. It is advised that a seemingly healthy person, at least once a year. But now, I don't even say once a year. I say every 6 months. Go for your blood work. Go for some imaging. Have yourself checked. You're getting older every day. A lot of things happen. You're under a lot of stress. A lot of things change. The fact that you had a clean bill of health last year does not mean that you have a clean bill this year. People that develop cancer all of a sudden, it just happened. Previously they were fine, but something crept in and something started, and some of them were lucky to pick it up in the early stages, and that is why they could be saved, because some early intervention would always improve the outcome. But if you don't do anything, or you do not check anything, the first sign that something is seriously wrong is probably when somebody has collapsed. That's when somebody will know, somebody can't just collapse, something must be wrong. When you go to the hospital, they go and check, and they now find what they should have found out 2 years ago. They now find it out then, and everybody's praying for a miracle that could have happened as a process. If you had picked it up early, you'd have started doing all the right things, making all the necessary lifestyle adjustments, changing your diet, being on the right medications, doing a close follow-up. But unfortunately, some people are not so lucky to live to tell the story, because the story just ends there.
One more thing is cataract.
Yeah.
See, I'm saying this because I know several persons who are really fighting this, battling with it seriously. And when I go moving on the street, I see young people, young men, young women, blind. I just ask myself, what's going on? Someone is leading you at this age. You are. I want you to talk about it.
Yeah. When it comes to
how to look out for all of these things.
Yeah. When it comes to visual health, it's actually a very broad topic, because, like I said, diabetes can be one of the things that can get people blind. So you can imagine somebody who has had uncontrolled sugar, had no idea ever since, suddenly goes blind. It happens. Then cataract, that you said, is usually age related, because as people get older, the lens of the eye, gets a bit opaque. It's meant to be transparent normally to allow light to pass through. So it gets cloudy, it gets opaque, and then, of course, that's what leads to cataract. It's typically opacity of the lens of the eye that causes cataract. So a lot of people, once they pick that up, they don't go to the hospital immediately to say, doc, please check my eye. I'm beginning to see that my vision is blurry. What do I do from here? They run all the necessary tests. They check your eyes. And then they tell you, oh, it's cataract. And they give you some eye drops and tell you, okay, let's wait for it to mature and then we'll remove it. Do a surgical removal because it's meant to be a surgery.
Okay.
But some people, when they hear surgery, no, it's not my portion. I don't want surgery. Or why would somebody operate my eye? But it comes from a place of not being well informed. Because that can save your vision. So if you don't want to do that, or the doctor has given you an appointment to come and you don't show up, and you go away for months, you are lost in the crowd for months, and then something now eventually happens, you lose your vision, and you now need somebody to move you around or help or guide you around. Everybody is wondering what has happened to this person. So that is one of the causes also. Another important cause is age-related macular degeneration. There is a kind of condition that we refer to as macular degeneration, whereby the central vision of the eye is depleted, because it's age related too, because you need some antioxidants, you need some important supplements to help with that.
Okay.
So people that are not going frequently to the hospital would not know what supplements to be on. They would not know what they should take or what kind of diet or what kind of things, fruits they should be eating, to improve their visual health. And then also you have the glaucoma. That is
glaucoma,
leading cause of blindness. People rarely check the pressure in their eyes. They don't follow trends in their family line. They have a grandfather that had glaucoma, their father had glaucoma, they had another uncle somewhere that had glaucoma. Instead of them to be having their alarms ringing, I need to check my eyes, I need to check the pressure in my eyes, because glaucoma has to do with raised intraocular pressure. The pressure in the eye is usually very, very elevated, and over time may damage the optic nerve and cause blindness. Most of them, they don't go for all these screenings, they don't go for all these checks, and at the end of the day, when blindness sets in, everybody thinks it's a spiritual problem. Everybody thinks, maybe you had a quarrel with someone and somebody inflicted you with this or afflicted you with this kind of blindness. So it's very important that, like I said, health is a responsibility. It doesn't just happen. If you find somebody who is healthy, especially in old age, our life expectancy in Nigeria isn't too good, right? So if you find somebody who is above 55, all right, and that age bracket comes with a lot of health challenges, because new things start cropping up that were not happening before. Women are getting into menopause, men are getting into andropause, men are developing issues, women are also developing all sorts of issues, arthritis, hearing deficits, cataracts like you talked about. All those kind of things, if you do not go to the hospital to be properly guided, you are going to miss it, because you're not going to be doing all the right things you're supposed to be doing. And you cannot self-medicate because you're not a health professional. And
Nigerians self-medicate a whole lot.
They love it. And the beautiful thing in Nigeria, but it's not so beautiful anyway. You walk into a chemist or whatever, a drugstore, and you just say, I want this, I want that. You should not be the one to tell us what you want. You should come with a doctor's prescription. You should have seen a doctor, and the first questions that should have been asked should be, have you seen a doctor? Or you walk into a drugstore and you tell them, I have this, I have that, this complaint or that complaint. The first question should be, have you been to the hospital? Has a doctor examined you? Have you done any tests? Where is your prescription paper or prescription form? Those are important questions, because if you cut off the doctor, you cut off the laboratory, you cut off everything that is part of the sequence of what you guide you into your proper diagnosis, then it amounts to trial and error, because anything they give you, it may work, it may not. Because those tests and the examination the doctor should do for you are not just there for fun. They should guide you towards your diagnosis. So if you have skipped those important steps and somebody is just throwing a drug at you, it's trial. If it works, you're lucky. If it doesn't, you come back, pay again and get another drug, and let's start testing different chemicals on you or different drugs on you. That's not ideal. If you love your kidneys, if you love your liver, that will do the detoxification and the excretion of these drugs, you won't just be sampling random medications. You would go for exactly what you need. And if you need those and for you to get those things, you need to see a proper health professional who would examine you and tell you that this is what you really need, and with the right dosage, and not just you being on a drug indefinitely. Because some of the things that we see in the hospital sometimes are because of side effects of medications, and people think it's an illness on its own because it will present like an illness. You see somebody nauseous, you see somebody having some kind of reactions on the skin, you see somebody having headaches that won't go away, you see somebody having sleep disturbances. And if you just take a thorough history and say, can you just show me all the drugs you've been on? And you start hearing, well, these drugs, it wasn't a doctor that gave me, but I've been on the drug. Okay, just pour them on the table and let's see. By the time you see them, you can pick up 1, 2, 3. This is causing your cough. This is causing your insomnia. This is not making you this is making you restless. This is making you palpitate. You can pick up those things, side effects of those drugs, and the person would not know because the person is not a medical professional. So it's always key that if you really want to have good health, you cannot afford to give yourself away to chance and say, okay, anything goes. You need to be intentional about these things, and you take only drugs that are necessary for you, that are prescribed by a licensed health professional.
Okay, now before I continue, everyone, this is VOPFM and it's Voice of the People. My name is Jude. See, if you have a question, all right, maybe let me give you a chance to ask any random question, all right. I don't know if I should take calls, but then you can send a message to me via WhatsApp. Okay, yeah, 081 717 56338. 081 717 56338. Okay, just send me a message there. A couple of persons are calling. No, should I take calls? It will slow me down. But instead, I want to read messages. Let me read messages, but then I'll just take few calls. Okay. Let me just take few calls first. Hello, good afternoon.
Hello, good afternoon, Kajude.
Good afternoon.
Well done, sir. Thank you for the good job you are doing.
Yeah.
Also, thank your guest. Your guest is really a true professional. Things he's saying are perfectly in line with what we feel that is good for us as the people. I want to ask your guest this question. You know, when you were talking about self-medication, sometimes they used to tell us that for us to build our health, especially now that the economy is smiling and to get balanced diets, you know, to put the body together is challenging.
Yeah.
So most times we advise to be taking some routine drugs like folic acid, ferrous, all those ferrous tablets, and folic acid, and those ones to be making up things that we cannot from our daily food. Just supplements like that. I think, are they also bad? Are they also self-medication? When we go for those things, to be taking them routinely to make up things we are not getting from our daily food.
Okay.
That's my question. Thank you.
Thank you so very much. I appreciate you. Now, okay, doctor, you have the floor.
Okay. That's a very good question, sir. Thank you for calling in and asking that question. So basically, supplements are good because first and foremost, as the name implies, they supplement your nutrients. The process of cooking food, preparing food, heating food, and all that, some of the nutrients, you lose them. So we need to supplement some of these vital nutrients, especially the minerals and the vitamins. And again, apart from preparation, depending on the quality of the food we eat, some important nutrients are deficient, so you may need to get them, from your supplements. But when it comes to the folic acid you've mentioned, which is usually in most of the supplements, it may not be ideal for everybody. For instance, just painting a scenario, a cancer patient should never take folic acid because folic acid would multiply the cancer cells rapidly.
Really?
Absolutely. So if you do not know where you stand in terms of your health status, you have, God forbid, the person has prostate cancer or breast cancer, and the person is saying, everybody is using it, I need to use it too. You may progress your disease faster than you expect. So it may not be ideal for everybody to do that. But ideally, folic acid is good for blood, is good for fertility, It helps you, stay healthy. It's make sure that your blood cells, you have a very optimal blood level. Iron too will do the same thing for you, and then all your other B vitamins, the C vitamins, very, very good, beautiful. But the essence is that I would always say it is best for you not to do these things by yourself. Let a licensed health professional that knows your history recommend what is ideal for you.
Okay.
Because if you do not have a basis for your medical records, then that means that anybody can take anything. And definitely all these drugs are not suitable for everybody. So it's essential that you go to the hospital that has your detailed medical history, and you've done a recent check, you are aware of your current health status, and your doctor is even in the best position to tell you this is the most appropriate supplement for your age. Because the nutritional requirements for different age brackets vary. What a child needs is different. What an infant requires nutritionally is different from what a school age child needs. It's different from what an adolescent needs. It's different from what a young adult needs. It's different from what a middle-aged adult needs. It's different from what an elderly person would need. So the nutritional requirements for your age varies. So your doctor is still the best person that will give you the proper guidance on what to take at every point in time. Self-medication is never in your interest. Even coming to painkillers, people will have pain. You go and get what we call NSAIDs. They are good, the ibuprofens, the diclofenac. You just start taking drugs on their own, and you don't know that if you have peptic ulcer, you will worsen your ulcer. If you are having asthma or you are having an underlying kidney problems, you may worsen the situation. People don't know these things. And gone are the days where you have a headache and a friend or a colleague tells you, oh, this is what I use for my headache, take, you can use it. You don't have the same medical history. You don't have the same medical
people
conditions.
do it a whole lot.
They do it a whole lot. They'll say, oh, I have this, you can
It
use
work
it.
for me.
It work for me, it should work for you too. But no, it may work for you, but you don't know if I have ulcer, you don't know if I have asthma, you don't know if I have an underlying issue, and you give it to me and you worsen my situation. So gone are the days where you just do things randomly. Everything must be done intentionally. Any medication you take, you must understand why you are taking it, and you must make sure that it is a professional that has recommended it for you. Because before a doctor puts pen to paper to write a prescription, he has considered 1,001 things. He has examined you. He knows your history. He knows everything about you. He has seen your investigation reports. He knows where the issues are. So before he says this is what is ideal for you, you will know a lot has gone into that decision. It is not just a random thing. Most people think, doctor has just written me this drug. Doctor doesn't just write anything.
Okay.
There's something behind it. There's a story behind that prescription. And you have to make sure that you follow that prescription and you do not change the medication by yourself, which a lot of people do. They'll say, doctor, that drug you gave me, I've stopped it, I've started this. And you ask yourself, on what basis did you do that? And who permitted you to do that? And what did you see that you decided to throw away the choice of your doctor, who is a licensed professional? You're throwing that away to follow what somebody else who is not a medical person is advising you to take. So these are all the issues that we have that run people into a lot of problems. And at the end of the day, these things are preventable, they are avoidable if we just follow the right channel, the right path to getting things done properly.
I want to ask, what causes blood pressure, really?
Well,
some will say overthinking, or maybe, what really?
Well, that's a very good question, because like I said, it's a very prevalent condition in our environment. So basically, blood pressure is persistently elevated blood pressure, and there is usually no cause for 90% of cases. We have essential hypertension. That's what we call essential hypertension. There is no identifiable cause in 90% of cases. In 10% of cases, you may have identifiable cause. Maybe the person has an underlying kidney problem, and when the kidney issue started, BP started going up. For some people, it may be drug-induced. They've been on steroids for some time. They became overweight. Then blood pressure started coming in. There's some people, they have hormonal issues, maybe a thyroid problem or Cushing's syndrome or whatever. What's it called, hormonal issues, and gives them blood pressure issues. But basically, in 90% of cases, you only have risk factors that have been identified, and some of the risk factors you can't do anything about them, some you can do something about them. The ones you can't do anything about are the non-modifiable, because you have no control over them, like your age. You can't control your age. You get older every day. like your family history. You don't choose the family you are born into. You just meet yourself there, and if it's in that family line, sorry. Then thirdly, your gender. For men are more prone to high blood pressure issues. For women, when they get to menopause, they now carry the equal risk as men, because some of their hormones in their reproductive age group is kind of protective for them. But occasionally too, we find women having pregnancy-induced hypertension. During pregnancy, they just find out that their blood pressure is going up, around pregnancy, which was not like that prior to pregnancy. So basically, for most people, there may not be any identifiable cause, but risk factors like the ones I mentioned, you can't do anything about them. But the ones you can do something about, like being overweight. If you're overweight, you're knocking the door of blood pressure. You're telling blood pressure, I am here. Please open to me. I want you. So if you're overweight, you're looking for it. If you're a chronic alcoholic, you're looking for it. Should smoke a lot. In fact, smoking should be eliminated if possible. You're calling for it. High salt consumption, you're calling for it. Poor stress management, you're looking for it. Chronic insomnias, you're having sleep issues, either problem falling asleep or problem maintaining sleep, you're looking for it. And people that eat a lot of junk foods, high cholesterol diets, so much lipids, so much fatty foods, everything fries, junk everywhere, they are also looking for it. But you can do something about these ones I just mentioned. You can do something about your diet. You can do something about your exercise. You can do something about your activity. You can do something about your weight. If you can't change the family you came from, if you can't change your gender, and you cannot control your age, you can control these other ones. So the ones you can control, you get fixated on them and make sure you are intentional about each of them. And if you're intentional about each of them, you will be amazed at how you can transform your blood pressure. So having a high blood pressure is not the end of the world. A lot of people live well into their 80s and above with that condition. So it's not a death sentence. You don't have to die young because you have high blood pressure. A number of people that we know well over 80, unless they tell you that they're on BP drugs, you may never even know. And they've never even had a stroke before because they've been compliant to treatment, and all these lifestyle changes, they've really been adherent to them. So it's possible, it's achievable for you to have a good quality of life, even having this condition.
Let me take this call now. Hello, good afternoon.
Hello, good afternoon.
Good afternoon.
This is Mr. Desmond calling from Oshwood.
Welcome.
Doctor,
Good afternoon.
all you said is all good. Good afternoon, sir. But one thing I noticed that no Nigerian want to do self-medication. It's because the way most of you treated some patients in some hospitals that made them feel like they want to do it on themselves. Take an example for General Hospital last week. We go there for a sickness. They will abandon you, keep on taking blood in your body for the next 2 hours. They will not give you medication. They want to make money out of the test before they can even treat you. Not even first aid. Most people die before they see doctors in last week here. You and I know that. Secondly, most doctors want to go and see them. The doctor, you have a card with you, will tell you to pay consultancy fee in his own hospital, 20k, 25,000 naira, to see a doctor you know before. This is a consultancy fee. With the way Nigeria is now, we will have more of self-medical people treating themselves, because the way most of doctors are treating people, they don't have human face. All they look after is money, money, and money.
All right.
And the drug is so expensive. So if the doctors can be able to have human face in seeing these people as their own people, I know you went to school, you want to take money, you want to make money, but let us look into it as if we're serving life. Let's put life first before money. But here in Nigeria, most of us put money first before life. I don't know how we can get it right.
All right, thank you.
Go help all of us.
Thank you so very much, Mr. Zimba. You want to comment on that quickly?
Okay, well, thank you so much for your feedback. Well, the truth is, when it comes to medical services or healthcare delivery, it's a tedious job to do. We do not have enough doctors. First and foremost, we must be clear on that. We don't. And for a population of 200 million people, you need more hands in the health sector, and you need capable hands in the health sector. You know about the brain drain happening. You know about the mass immigration to other countries.
It's called Jakba.
It's called Jakpa. And you know the reason why the doctors are Jakparing.
Mm-hmm.
They're Jakparing for better life, quality of
Greener
life.
pasture.
Yeah, and good working conditions, you know, and they want a place where they can thrive. So for the few ones that you have here, that is the truth. They are overwhelmed. You are human, overseeing countless results almost at the same time, countless things that are competing for your attention all at once. Is a safe place for people to come to, not a place where they will come and catch more infection or get worse than they were before they came to you. So maintenance is not cheap, and making sure that your staff are well remunerated so that at least they can give the best, you know, during their shifts is a lot. It's taking a toll on everybody. So it is not that doctors do not have human feelings. If they don't have human feelings, they won't go and study them in the first place. Medicine is a vocation. Apart from it being, you know, a noble profession, so to say, it's something that has to do with you having love for human beings, loving people, desiring to help people, alleviating suffering. That is what medicine is all about. Every doctor you see out there, they swore to an oath to save life. So if they don't love human beings, they won't be there in the first instance. And what it takes to be a trained doctor takes years of hard work, years of discipline. So much resources has gone into that. So you can't say that a doctor now comes out and does not have a human face or does not have human feelings. That is not entirely correct. For it. And those factors are always beyond the doctors, way beyond them, because the whole situation is so tight and it's reflecting on the quality of their work as well. So that is what you are perceiving as them being sensitive. And then for the issue of the consultation fee that you're talking about, I think it needs to be addressed. Because for me, I know that every professional charges fees. If I want legal services, I walk into a law firm, I'm going to pay.
Okay.
I'm going to pay for somebody to write something or sign some documents. I'm going to pay for somebody to represent me in court. I'm going to pay for somebody to his professional service charges. It's absolutely normal and it's everywhere in the world. Rarely would you find a place where you would not have to pay, especially in the private setting. It's just normal. And they need to get running costs for the hospital.
For instance, you use this particular hospital before now. I mean, that's where you go to whenever you are. And so, I mean, are you permitted to, say, collect that kind of, this, what do we call it now? What, like, Mr. Desmond called it? What fee did he call it again?
Consultation
fee. I mean, are you supposed to, collect consultation fees again?
The fact that I have the hospital missions.
No.
Where does my income come from?
I'm your patient normally.
Yes.
Right?
Yes.
I come to you every time.
Okay.
I have a file. I have a,
absolutely.
You understand?
Yeah, I have your records.
All of my records,
yes.
right? And I'm coming again to see my doctor.
All right.
Am I still going to pay? Am I supposed to pay? That's what he is saying.
Well, the truth is, for most hospitals, they have policies. A hospital is also an organization, and they are bound by rules and principles, that governs them. So a hospital can decide that, okay, a patient comes in. If he's a fee-paying patient, he's not an insurance patient. It's only insurance patients that would not pay, because the insurance company takes care of that. But a private patient comes in. My policy in the hospital would be, okay, for every consultation they pay, this consultation you're paying now covers you for a period of 2 weeks, or covers you for this month that you're coming. So anytime you come this month, you may not need to pay again after this initial consultation. But subsequently, if you come, you would need to pay for consultation. Because when you are consulting a doctor, consultation is not just that you're telling the doctors your complaints. By the time you are listing all your complaints to the doctor is brainstorming heavily on your case, because 1,001 things may be responsible for your symptoms. So the doctor comes, narrows down everything, listens to your big story, starts eliminating things, does some substitution somewhere, comes out with a diagnosis, sends you for tests, interprets your tests.
Okay.
That's a lot.
Let's hear from this person. Hello, good afternoon to you.
Hello, Jude. Good morning.
Hey,
And
Prince Aquachi is here.
I don't know if I should say it now, but whatever. Happy birthday. And I
Oh,
guess I'll reach out to you later. But let me talk to the doctor. In
okay,
talking about health.
okay.
Doctor, my worries about Nigeria is that the primary health of Nigerians are so poor. What do I mean by this? You know, I hate to compare Nigeria to other places, but it's just that in other places, when a child is born, there are several tests that are being carried out. The tests that will determine what could be a problem in the future of the child,
Okay.
like things like allergy. Okay, now you agree with me that not everybody, or would I say, not every child is have that ability to accept every food, the food allergies, and then they have reactions to it. And sometimes before you know it, the mother, in Nigeria, they'll start thinking there is an uncle in the village, there is a grandma in the village that is trying to take the child
Okay.
away, and all that kind of a thing. And the thing is that I don't know what the NBA is doing, is it NMA is doing in order to educate people on that.
Okay.
I don't know. So if you could throw more, a little light into this, and okay, just like every other person, the fact that people go to the hospital and the doctor, before they could even attend to the people, they depend so much on the registration.
Okay.
Things that could be done. So thank you.
Thank you so very much. Appreciate you. Okay. Let's go. Talk to us.
Okay, basically, thank you, sir, for having future. Some children are born with cleft lip and palates that can affect their feeding, their hearing, and all that. All those are important checks that we do to the newborn. But, because Nigeria still has a long way to go in terms of advancements in diagnostics, advancements in technology. There are some conditions that we do not have here that are, prevalent in other climes, that they or that's why they have a wider to live healthy. These are the things you should avoid. Doctor will not leave it for you, would not eat those foods for you. He doesn't live with you, he doesn't eat with you, he can only advise. So everything still drops on you. The ball is in your court to take the necessary steps and to make sure that those steps are taken the way it suits them, not necessarily what is good for them. You tell someone, please, this your child must be exclusively breastfed for this length of time. Person will say, I'm a working mother, I don't have the time. Generally, nurses, matrons, you see them in the consult how to better their lives. And what do people listen? Look at our environment, for instance. You don't want to look at your drainages, what they look like or what is in those drainages. And when it rains and you have the torrential, what is spilling all over the place, sewage water mixing with water for consumption, you have cholera outbreak, you have all sorts of things going on. It's not that people don't know about these things, but people still dump things in the gutters. People still make sure that, anyway, don't let me use the word make sure, people don't clean up their environments. Their environments are still very filthy, and you expect to have healthy people coming out from those environments. It's almost impossible. So I think doctors, health professionals are doing their bit. And like I said, the ratio of the health professionals to the population is nothing to write home about. So you're talking of very few people trying to help a large
All of
number
them don't
people. And all of them don't go. All of them don't dust their shoes, carry their bags, come out. So, there's a lot of work.
And then he
to be
spoke
done.
about this registration thing.
Sometimes you run into problems. It's late at night, it's past 10, we can't access money. Where do we get money from? This is an accident. Then we'll attend to you. They said, no, please just save this person's life. Money will come later. This is not, at the end of the day, this is a young person now. And I got into amongst the people because they came in as a crowd, the crowd of people came with the persons will be paid. I said, hey, we're not hearing you, and they're off the call. You try to call them right and just pick up,
But they will tell you this is health. This is someone's life.
This is someone's life. Yes, but you have saved someone's life, but you have refused to do the needful. Can somebody open a hospital and not run expenses? You are not going to have expenses. You will not have running costs. You don't have salaries to pay. You don't have maintenance costs. You don't have drugs to buy. How do you sustain your business when everybody comes and they want to get free service? No, we should be factual here. People run their own private businesses. They will not do that to their own business in other sectors. They wouldn't. A lawyer would not put pen to paper for anything if he is not paid his fees. He will not represent you in court, no matter how much you beg that you will go to jail. This is jail, jail matter. He would not. You have to do the needful. So why is it different in the health sector? We need to be factual here, and we need to also put ourselves in other people's shoes too. Money is not everything, I get that. But people should also learn to appreciate the service that has been offered to them. You pay for services rendered, good service rendered. It's important that Nigerians need to reorientate themselves on that. The fact that it is health, yes, we know it is health. Leave that to the doctor. He knows that's what he is trained for, to save lives. And he will save that life. But you should also learn to appreciate them for what they are doing. Because they are humans and they have bills to pay. I'm a doctor. If I book an Uber now, I go into a store, I go into a fine restaurant. Even the person that I saved last night, that is the owner of the restaurant, will charge me for the food I'm eating. True or false? Mm-hmm. He won't say because I saved his life yesterday when he had an asthma attack that he didn't die.
No, if you go there like 2 or 3 times for free,
Story.
then
Nigeria.
maybe the fourth one.
Nigeria.
From the fourth 50.
No, Nigeria. If the person, immediately the person sees that doctor is here, the person will just, pretend like he's answering a call and walk away. And say, I better collect my money from doctor. The doctor may not say because I come to his hospital yesterday, go things say, go eat free food though. So you pay for services. So we should get accustomed to that. Even in developed climes too, you pay for services rendered.
Doctor, sugar level symptoms quickly.
Sugar level symptoms, very important. You need to make sure that once you notice you are urinating frequently, you may have a high sugar issue. Increased thirst, you are feeling thirsty all the time, go and check your sugar. You are feeling hungry all the time, go and check your sugar. You are losing weight without trying, unintentional weight loss, go and check your sugar. You are having tingling, numbing sensation in your fingers, in your feet, like you're having pain and standing on pins and needles, go and check your sugar levels. And then sometimes you may even feel that blood is not circulating in certain areas of your body. You could have your sugar levels checked as well. You have erectile dysfunction as a man, have your sugar levels checked. You're having blurry vision, have your sugar levels checked. You go for an eye check, an eye examination, and the eye doctor gives you a pair of glasses, and within a month you're thinking you need to change your lenses again. Within a short time, go and check your sugar. So those are good indicators of sugar issues. Those are very, very significant indicators of a high blood sugar that may be ignored, or you may think, or you may just sweep it under the carpet and regard it as normal, or think it is due to some other things. It may just be high sugar.
Again, this back pain thing. Back pain, everybody back pain.
Lagos traffic, first and foremost. You're in traffic, you're seated most of the time in traffic for hours in traffic. And sometimes for people who drive themselves, the posture, your sitting posture is a major factor. People that sit long hours, the bankers, the executives, people that are always seated for long hours, you would have them have back pain, chronic back pain. It is not unusual for them to have back pain. People that do a lot of lifting from the ground, they may have back pain. So all those are essentials. But the important thing is, once you notice you have that, please go to see your doctor. Your doctor will order for some imaging test, either an x-ray or an MRI, to find out the cause of your back pain, and they will treat it appropriately. Either they also place you on some medications or invite a physiotherapist to also assist you to getting you well again, because there are a number of things that can cause back pain.
Now, what's it called? Someone said something. He said, I have a doctor friend who smoke a whole lot. Still, his health is whatever. I don't know. A good health.
He's bouncing, right? Yeah. But
you've heard that, right? You know that, right?
Many times. But I keep telling people, you were not born from the same mother. You do not have the same genetics. You don't have the same makeup, the same constitutional makeup. So why do you compare yourself to another person? The fact that somebody is doing some kind of harmful behavior or is addicted to something that is not healthy and seems to be getting away with it doesn't mean you will be that lucky in your own case. So why risk it? If you know something is potentially dangerous to your health, just like when they do all these adverts, there's that little caption they say at the end of the day, smokers are liable to die young. Everybody hears that, but that still does not deter them from smoking. So smoking is an addiction. So we come to that is another topic entirely, when people are addicted to certain things, and that addiction means that they have compulsive engagement in those practices. They cannot help themselves despite adverse consequences that they know about. So it's uncontrollable. So people are addicted to alcohol, they're addicted to smoking. But the fact that it seems that some people are getting away with it doesn't mean everybody should try it, because you may try it and unfortunately you may come down with some horrible illnesses, and you'd have been better off without it. I cannot explain why it seems some people are getting away with it, but you cannot say that they are completely getting away with it, because they are still alive and they are still going to get older. You don't know what may still crop up, with time. So it's only time that will tell if they actually got away with it or not. So it's better not to compare yourself. When it comes to health, there's no basis for comparison at all. You don't compare your health with anybody's. You are unique, you are peculiar, your case is peculiar, and your conditions are peculiar. So you don't do any comparisons at all.
Okay, thank you so very much. I've got several messages here, a whole lot of messages here, but I am trying to just look at it very well. Okay, what do you say about herbal remedies? Also, are we encouraged to take plenty herbal and organic foods to counter too many chemical food around us in our current world, which are reducing lifespan? What are you trying to say, Doctor? Healthcare is out of the reach of the common man in this present economy, hence the rampant self-medication. Please, let's use the media like this to be telling our leaders to subsidize healthcare. Many masses are dying due to poor health.
Yeah, correct. So starting with the herbal remedies, well, before orthodox medicine came, there was a way people were treating themselves, natural herbs and all that, roots and herbs, and people got well. Yes, I would not dispute that. Yes, they may work, but the truth is a lot of research needs to go into all these things. Before any medication is written out for public use, it has gone through a lot of research, it has gone through a lot of clinical trials, it has gone through a lot of experimentation, and they use a small study population first, and they oversee them and supervise them over a long period of time. They monitor them closely. There's a surveillance that happens to notice all the potential side effects, the toxicity levels and all that. Over a period of time, they make sure that there are no short-term, immediate-term or long-term complications or adverse reactions to those drugs before they can say, okay, this drug is safe for use. So it is not just that some scientist somewhere will just conjure something and they just throw it out. Every medication you see, a lot of work and time has passed before it was, verified to be suitable for treatment. But for the herbal remedies, a lot of work still needs to be done on them. And mind you, a lot of reaction occurs when you combine a number of things. Most of these herbal remedies are actually mixtures of different things. So you can imagine you mixing item 1 to item 10 different items in a particular mixture. If you are reacting to item number 4, which you don't know because you didn't prepare it yourself, and you're reacting to item number 4, maybe you're itching or you suddenly have some kind of body swelling or some kind of rash on your body, and you get to the hospital and you tell the doctor, oh, your face is swollen, you have rash all over. The doctor is not a magician to know what you took. The first thing the doctor will ask you is, what did you take? And you would say, I don't know. And when you say you don't know, then it becomes a problem because the doctor doesn't know where to start to help you. But tell the doctor that you took 100 tablets of paracetamol mistakenly. He knows the antidote to give you.
Okay.
He knows the right thing to give you because a lot of years of study, a lot of documentation, a lot of scientific work has gone into you have this poison, this is the antidote for it. This toxin, this is the reversal for it. But in that situation, how would you help such a person? And sometimes some of these remedies are toxic. Some of them you have them, in alcohol, you have them in gin, you have them in all sorts of mixtures that I don't know. And at the end of the day, you take all these things and you damage your kidney and your liver, and you suddenly start noticing feet swelling that was not happening before and all sorts. the bottom line is you have to be well informed. Every single thing you take, you have to know why you're taking it. You have to know the components of what you're taking. You have to know the constitution of what you're taking, so that if there's a problem, you know where to run to and you know what to take to avert potential danger. But if you're taking herbal remedies, you don't even have the right dosage most of the time. They tell you, take 2 cups of this, take 2 bowls of that. My own cup may be times 10 what your cup is. So we have a measuring or a dosage problem. Then we also have adverse reaction problems. Then we have kidney problems, liver problems. And when allergies crop up, you don't even know where to start from. The doctor is even at a loss on how to help you. So we always advise that, for me personally, I tell people, whatever you want to take, be sure of it. So if I give you a medication and you come back to tell me that, doctor, I've been having a headache, I can trace the headache to whatever it is I've given you. If there's any of the drugs that has a potential effect of that, I would have even told you ahead that in case you feel nauseous, it is this drug causing it. In case you feel a bit of restlessness or you can't sleep well, this is the drug that is causing it. In case you notice you're peeing more than usual, like it happens with some of the BP drugs, we would have told you beforehand, because we know what these things are. But when you are taking something that is random, it becomes a problem. So we tell people, yes, we know that these things may work, they may be beneficial, but before we can beat our chest to confidently tell you, go and take them, we need to be convinced. And science is all about experimentation, all about evidence-based practice. Let us see that these things work for real. And let us know the right dose that is appropriate. And let us know the potential side effects. And let us do a research. Let us do a kind of experimentation with a group of people. Let us see that it works. And let us see that it doesn't pose adverse effects later on. Because if you're starting a new medication, the fact that the drug worked for you now, and you started with maybe 100 people, and everybody say, perfect drug. 90 out of the 100, you said the drug is a beautiful drug, it's a wonder drug. And in 3 years' time, all of them go blind. It's possible, because that is part of what the clinical trials will bring up. That is what the experimentation and the surveillance will do, because it's going to monitor all the people in that group that took the medication and see what symptoms they come up with, or any medical condition or any new problem that crops up with them that is uniform to all the people that took the drugs. And that would inform the decision on
Yeah.
and that would inform the decision on if to push the drug out or not.
All right. Hello, good afternoon.
Hello. Good afternoon, sir.
Good afternoon.
Well done, sir. Please, I have a question for your guest.
Quickly, please.
He made mention of like women having like, he had mention of women having like 3 children like that. But some family planning that they say, some family planning, they said it can lead to obesity and high blood pressure. So what do you want to do in that case? Thank you, sir.
Okay.
That's a very good question too. Like we said, our society starts with families. So the family must be healthy for the society to be healthy. So if you want a healthy family is not just a family that is disease free. A healthy family is a family that can eat well, nourishing food. You can meet up with all their basic needs, good shelter, clothing, and all the essentials of life, So basically, for you to have a good family and a stable family, you have to make sure that it's a family that you can cater for and you can provide for all their needs. So you have to have a moderate number of children. We hear what is happening globally in terms of the economy. Everybody must make sure that they have enough to take care of their family. And with the rising inflation and everything, the fewer the better for you. So the school fees are not smiling, hospital bills are not smiling, drugs are not smiling, foodstuffs are not smiling. So go to the hospital and let your doctor choose the option that is most appropriate for you. There are different options for contraception.
All right.
So your doctor is in the best position to determine what's
thank you so very much, everyone. I want to have this kind of conversation. Okay, one thing, like I introduced business matters on Tuesdays. All right, and this one is health. These are issues, but then I would need some persons to, if you're into anything health, got a hospital or you're into drugs or whatever, I'll need you to look into this. I need sponsors on this right now, all right? Because this is what we need every day. If you're into food, if you're into, I need sponsors on this so this can continue, all right? That's what it means. So please, I'm actually asking you, urging you, pleading with you to let's do something about this particular show, okay? And I want to be bringing in, doctors, specialists and all of that to talk to us. All right, tell us what we need to do and what we shouldn't do as regards our health, because health is wealth. Lagos, everybody they find money seriously. Back, free take go. People really don't check their health.
They don't sleep well too.
Oh, really? Lagos don't sleep well.
Sleep is an issue now in Lagos. If for every patient you see, minus their complaints, there's sleep as icing on the cake. Sleep problems. People don't sleep well. They wake up very early, get back late. Before you know it, alarm is ringing. They have to jump out again, and they are getting accustomed to that. So there's a lot of.
Somebody tell you, I'm used to it.
I'm used to it. So there's a lot of sleep deprivation. And I tell them, sometimes people come to the hospital, the kind of complaints they give you, they are non-specific symptoms. They are not pointing in any direction. And you just tell them, what is your sleep like? They just say, doctor, who sleeps in Lagos? Tell me who sleeps in Lagos.
Okay.
Nobody ever has time to sleep. Everybody's on the move. There is always something to do. And at the end of the day, if you don't sleep well, the potential effects of not sleeping well are very, very, very grave. You don't want to talk about you having unnecessary body pains, focus and concentration is negatively impacted. You may have memory decline. You may have low energy levels. You might be irritable. Your mood and everything, snapping at people all around, behavioral changes, because you are stressed out. Your stress levels are at an all-time high. And then you are vulnerable to falling ill too, because the amount of stress is directly related to how your immune system would be. If you are under so much stress, you are vulnerable to falling ill. That's why people fall ill during exams, and people think it is village people. It's because of the stress associated with those things. You're not getting enough rest, too much activities, and you're not shutting down. You're not having enough rest to rejuvenate yourself. So you have a high risk of developing so much issues, memory issues. That's why you have young people now, they tell them something they've forgotten by evening, a lot of decline in so many things. So it's so important that we emphasize the need for rest. We work hard, yes, but let us also create time to rest, for relaxation. Very key. So that both physically and emotionally you are well rested, and that's how you can be productive. That's how you can succeed in anything you're doing, because you can't just keep burning out repeatedly. Because repeated burnout will tell on your productivity. You can't be the best at what you're doing. You can have the potentials, you can have all that you need, but if you're not in the right frame of mind, or your body is not in the optimal state to achieve your goals, then there's no point.
I wish we could have a health seminar, where we could come together in a very large number and talk to ourselves.
Absolutely.
The Lagos, people are with this japa thing and the high, everything is just on the high. Drugs, so much. We need to talk to ourselves.
And they've tripled, because many of your good pharmaceuticals have left the country already. So most of your drugs are extremely expensive, and that has nothing to do with the doctors here. So we need to clarify that. So the drugs are already very expensive, and some people need to be on these drugs, long term. So how sustainable is that? Prices are increasing, but income is constant. Something needs to be done. Not to talk of the foreign exchange, issues. So these drugs, since they are not manufactured here, the cost of bringing them in, and the cost of the drugs, and even the pharmacies too, they would also want to make some profit. So at the end of the day, it's really biting hard.
Doctor, thank you so very much. We have to go, or else I will take the whole Lagos call and messages today. Thank you so very much.
Thank you for having me. Thank you.
I know what to do, don't worry. I know we'll have you here again, but then these people will decide if we should continue with this or not. Okay?
It's all right.
Thank you so very much.
Thank you so much.
Yeah. Everyone, my name is Jude. Ikami Jude. I'll be here again on Monday by the special grace of God. Okay? And don't forget, again, I want to say, celebrate me tomorrow. It's my birthday. Hallelujah, it's my birthday. All right? Thank you so very much, everyone. On Instagram, I am Ikami Jude. IKAMIJUDEH. I would have asked the doctor to do same, but you go disturb him. Do you mind
Do you mind what?
your social handles?
Yeah.
But you see, ready for waiting, you go. So you go. I'm telling you now. Somebody will wake you up in the night.
Okay, I'll try to respond as much as I can because it's just a new social media handle that I'm building up. So
Oh yeah, we need enough people there. Okay, please yeah. So please call it.
Okay, so it's 24 hours Medicare.
24 hours
Medicare. Yes.
Just
on Instagram.
on Instagram.
Yeah, so maybe people can follow there, drop your questions, and I'll make out time to respond.
Doctor, you go answer question, Taya.
I will answer as my pace, as much as I can.
It's okay.
Thank you.
24 hours
Medicare. Yeah. Thank you.
Everyone, my own is Ikamijude. Yeah. IKAMIJUDEH. On Facebook or Instagram, everywhere. Ikamijude. Thank you so very much, everyone. Well, I'm just so happy today. I'm happy today. Don't worry. See you on Monday, everyone. Have a wonderful day. I'm out of here. Good afternoon.